And the purpose of this study was to determine the impact of the climate change on the children. As already by Dr. Irfan has been mentioned mostly, but just for the sake of bringing everyone on board again, as we know that we are the fifth most vulnerable country from the global climate change index perspective by 2020. We are facing a lot of natural disasters in the country. More than 152 natural disasters happen in this country in last 50 years. So for last 20 years, and there are the varied nature, which are someone is a very high, someone but very low. We are expecting some extreme weather conditions due to change in temperature and precipitation, which are the two main causes when we link about climate change comes in our mind. Ultimately, this has affected our food security issues, education, health, and social well-being, especially the children. And ultimately, this has increased their vulnerability. And most importantly, when we talk about children, health, education, and their social well-being, that becomes their rights issue. So there, from that perspective, we think that a climate change as a right issue from the perspective of the children's rights when they are being denied or they are being threatened from these kind of the different scenarios. As mentioned by earlier, but I just want to make a small deviation. If we look for the first on this slide on the left-hand side, where we are talking about factors exacerbating the vulnerability of children in Pakistan, we look the first from 1961 to 1990, which is the first part of this left side, where we are mentioning about the monthly rainfall. We see that the monsoon period was the period when we have the wet periods, and then there was a time when February, March, we have the wet times. And certainly we have noted there is a change coming, which is coming from 1990 to 2010. We are noting that the wet period is shifting slightly earlier, and similarly, dry period is becoming more wet, and whereas drier period is becoming drier also. For example, in November, December, which we were slightly have some kind of the precipitation available for wheat crop for the December, January. If we look at the second period, 1991 to 2010, we see that this is becoming drier compared to the 1961 to 1990. Similarly, we are also seeing that we are getting more wet at the time of April, May, which was previously more drier, and especially June, at a time when we were growing other crops. We have noted from 2010 to 2020 temperature, we see that the wet period has become the wettest, while the drier has become the driest. So no, we don't have much precipitation available in November and December, a time when wheat was being grown in the country. While we have much more weather in February, March, we have the more wet period at a time when wheat was being ready for the cultivation. So that is a time when wheat does not need much precipitation. So that is affecting the growth of the wheat sometimes in the country. So these temperature changes, simply I am mentioning here in case of only one wheat example, that shows that there is a change in temperature is basically affecting the not only the agriculture productivity, but also the planning and other impacts which we were doing for different activities. On the second part, if you look at the right side, which is a green, where we are talking about the annual mean temperature anomalies in the country for 1961 to about 2020, we see that the average in North Pakistan temperature change is about sometimes 4.8 degrees Celsius, which is very high, especially this is very high in KPK area. Overall, this is very change in monsoon is 4.5 degrees centigrade. So this erratic pattern also does shows is that there's not a consistency, which means is that a change in temperature is very directly related with with the growth of the crops, as well as with the when it is affecting the food security, but also the different kind of the patterns about the I mean say storage of the water also. So implication of the water resource management and agriculture and sustainability of the water and sanitation system is very highly linked with the change in this temperature and precipitation in the country. And under this study, what we have done is that we map different kind of the impact, which are the direct impact, and then we have also mapped some of those which were the indirect impact on the in terms of as a result of the climate change. So we have tried basically this study has just covered the perspective of the disasters which are related to the mostly which was droughts, floods, heat waves, and air pollution in the country. While in droughts, we see that there's a foodborne diseases, decline in crop productivity, vector-borne diseases, while similarly, indirect impact was about the breastfeeding practices, decrease in livelihood, displacement, migration. I will explain it later on the next slide. But this is a summary if we noted that. So most of the impacts and indirect impacts of the climate, they are interlinked with each other. It means drought does have a simply relationship with the temperatures and precipitation. Similarly, floods have some relationship with the temperature and precipitation. So overall, rather than going on temperature and precipitation, we have identified four key issues, which were drought, floods, heat waves, and air pollution, and then try to understand what are their implications. So, for example, when we are talking about the droughts in this country, drought basically comes as a result of increased frequency and intensity. And this results two things immediately. One is a rise in the temperature in that particular area, and the second is the water availability. From that perspective, if we look at that, but there are the 50 incidents reported in Pakistan for last 50 years about which has high impact of the drought in the country. And as a result of those incidents, we have three key features. One is there is decrease in agriculture productivity. The second was a change in water availability. And third is a reduced income opportunities. When we talk about decrease in agriculture productivity, we have seen this as a result of this one, there is increase in malnutrition among the children and impact on the maternal and fetal health of the children. Ultimately, this has restricted the fetal growth, neonatal diseases, stunting, which is high in all over the Pakistan, and then decreased breastfeeding practices. Similarly, we look at the change in water availability. This has resulted as a increased waterborne diseases and decrease in water quality and quality issue in the country. When we talk about reduced income opportunity, this had increased environmental and forced migration. And if we look at the data which is available recently for the out of school children for last during the drought period, we have noted that a 59% children of school age group in Balochistan and 42% in Sindh, where the drought hit districts, they were out of the schools. That clearly shows that when there is a there are incidents of the drought, there is highly likelihood the children will not be attending the schools. And also there is high death risk associated with the malnutrition, which is by 9 times more risk. And unfortunately, the data of 280,000 children which were died in drought hit areas for these incidents, 35% deaths are due to malnutrition. And we have already indicated that malnutrition is directly related with the productivity of the agriculture. Secondly, we have looked at the floods, and the floods is very erratic in rainfall in this country, which is sometimes the flash floods, sometimes erratic. And they have basically four kind of the key relationships. The first is the waterborne, vector-borne, and respiratory diseases. The second one is injuries and death. Third is the behavioral disorders, and the fourth is damage to infrastructure, crops, and communication network. When we talk about this, unfortunately, Pakistan is the fifth most flood-prone country globally considered. When we look at the waterborne diseases, and we have mentioned that we clearly see that pneumonia, diarrhea, hepatitis, typhoid fever A, leprosis, the yellow fever, dengue fever, and other illnesses are due to. And we have noted that 480,000 children treated for severe diarrhea, pneumonia, and acute respiratory infection after 2012 floods, which shows that a high number ever seen. That clearly shows that floods has a direct relationship with these diseases. Similarly, we have seen that as more injuries and death, and children are more vulnerable. And we have noted that the 2015 floods, more than 38 direct deaths of the children happened only in Punjab and 27 in KPK. Similarly, there we have noted that there is a behavioral disorder issue because of this floods. There is a decline in the mental health, loss of appetite, decreased school performance, and post-trauma syndrome disorder among the children. And this has been shown that after 2011 floods, 73% of the children show post-trauma syndrome disorder as a result of the floods. And ultimately, the third one, which is a damage to the infrastructure and the crops, which have shows that there is loss for the jobs. Agriculture productivity again came here, then decreased access to the wash services, and direct destruction of the building is which ultimately goes to the sanitation related illness, malnutrition, school attendance, and disruption in the healthcare system. Only in 2010 floods, more than 515 health facilities were damaged, which has cost us about $3.11 million US dollars to the education sector only. And similarly, 60% deaths in children are due to water and sanitation related illness. Diagnosis of the malnutrition among 77,000 children after 2012 floods in the only flood prone districts were identified. The third major element which we identify or which we have gone through this our study was air pollution. And we know that there are two kinds of the indoor and outdoor air pollution. When we talk about indoor and outdoor air pollution, this is direct relation with exposure during the pregnancy, which reduce the lung functioning, reduce birth weight, and neurodevelopment disorders among the children. This ultimately decrease the mental development of the children, and ultimately this result to the mental health and behavior disorder during the later life stages. The second one issue is related with the respiratory infections. So lower respiratory tract infection, asthma, and bronchitis is more common among where the air pollution is very high. Similarly, the third factor, which Punjab is also very high witness, is the smoke, and that affects difficulty in breathing, disability, skin and eye infections, and headaches. And ultimately, this reduced the decrease in school attendance, productivity, and school absenteeism. And respiratory infection 1.5 times more likely among the children in household using the polluted cooking fuels. This cooking fuels. So this shows that we need a clear air fuels. 12% of the deaths in children under 5 are due to air pollution as per the global research evidence is available. And unfortunately, in Pakistan, about 8,000 cases of the bronchitis were outdoor pollution, whereas 80,000 hospital admissions and 5 million cases of respiratory illness are being reported due to air pollution in the country. Unhealthy air quality index, particular matter 2.5 concentration 6 times higher than WHO recommended limit in Pakistan, unfortunately, some of the cities. The third element which is related when this heat waves, which is fourth one basically, is a heat waves results constant rise in the temperature, which ultimately had again relationship with impact on the fetal and infant health, impact of cognitive abilities on health and direct impact on health and well-being, exhibition of the health impacts, and decrease in agriculture produce. When we're talking about impact on fetal and infant health, low birth weight, increased chances of preterm birth, and brain trauma is more common where the heat waves cases are reported. While impact on cognitive abilities, there is school performance decrease, low test scores in schools, and decreased school attendance has been noted in cases where heat waves exist. Similarly, in terms of the impact on health, there are the skin rashes, heat exhaustion, temporary losses of consciousness, dehydration, heat stroke, and death. And ultimately, similarly, there is health impacts, increase in allergic diseases, decreased functioning of the respiratory and immune system, and waterborne and vector-borne diseases are reported. Decrease in agriculture productivity, and which does mean increase in food prices and food insecurity, increase in water demand and water stress. Heat wave of 2015, which was particularly in Sindh parts, especially Karachi, had resulted in deaths of about 1,300 people, which was one of the most deadliest heat wave Pakistan has witnessed. If we look at the last but not least is the climate-related diseases, especially this is the malaria, which has direct, and we have taken the data for 4 years from 2014 to 2018. And so if we have noted is that there is a fluctuation. And especially if we note that the period of the June, July to till October, sometimes in cases of November, there's high incidence of the malaria in the country. And that is a time when we have the rainfall, floods in the country. That is a time when there is a changes in the pattern. So we need to identify, and as a result of those infectious diseases, there's a high burden on the health systems as well as high losses of the productivity. Similarly, we have noted diarrhea and cholera. This graph is not correct. In the report, there's correct, unfortunately. There is a period when we note that diarrhea and cholera is more common at a time when there's a floods or rainfall high at a time. So there is a direct relationship of the diarrhea and cholera with the rainfall and temperature changes. Similarly, dengue, which everyone knows, and dengue is emerging kind of the climate disease. And we have noted that when there is a change fluctuation, so we have noted the data and there is sometimes of the periods, and mostly it has come that it has been high during the period of the August to December. And unfortunately, this was high time in 2019, but it is up to 320. And this was a good compared to the previous year. Unfortunately, the COVID-19 and the situation was much better. The people were taking care. But previously, if you look from 2014, the data every year, we see some growth from 2015, 16, 17, and 19 was the worst time when we have the high number of the. In this study, we have tried, as I mentioned, we have just taken the connection between the floods, the heat waves, then drought, and then these climate change related diseases. So based on that one, we have, as I have already mentioned, about different kind of the impacts, and we have done a literature review where we did try to find a relationship between the different kind of the impacts and their empirical evidence-based losses attribution. So we have used the attribution method while calculating the annual cost of the climate change losses in Pakistan. So based on that one, we have noted that the highest Pakistan and the loss because climate change is due to air pollution, about 34%. So nearly 1/3 of the economic cost is due to air pollution related to climate change. And the second number comes water supply. This does water supply is the drinking water, which we have calculated on the basis of the PSLM data, where we have noted the how many houses they have access to the water and how many of them are basically using the groundwater sources and how many of them are using basically purchasing from the market. And that has been basis on that one, we have calculated the costs related to that one and what are their implications on the climate. So after air pollution, the water supply is second one, and after that, the malnutrition is the third one. Temperature-related dairy is the fourth one. So there are the two bounds. One is the lower bound, and the second is the upper bound. In case of the lower bound, it is 1.3 billion, $1 billion, which is about 0.6% of the 0.4 to 6% of the GDP. While 1.87 billion in case of the upper bound. In upper bound, what is the difference is that in that case, we have taken the maximum limits. For example, in this case, if we look, the air pollution has come down from 34% to 29%, while water supply has increased by 2%, it has moved from 25% to 27%. And in upper bound, if we see the temperature-related dairy has also increased from 9% to the 17%. So that does show is that we have taken, because this is an attribution method based on the research done by secondary data. So in these cases, where the people have given the upper limits, that has been used in the second. And where the people have given the lower side, where they are mentioning the conservative estimate. So conservative estimate shows about $1.3 billion US, while upper side, it shows 1.87 billion. It does not include the energy and other many factors. It's directly related to the climate change with the socioeconomic behavior kind of thing. Because the recent study done by the World Bank is almost double. They are mentioning about $3.5 billion annually, while our study is showing about $1.87 billion. And we have given the all attribution factors and the main report where we have mentioned that how we have calculated the carbon loss, how we have calculated the carbon-related life losses, how we have calculated the water cost, how we have calculated air pollution cost, and what was basically hospital visit. And all those costs which we have taken are very conservative costs, keeping in view the poverty level of the country. Another interesting part in this study was that we had developed a climate change vulnerability index for the Pakistan. Unfortunately, at a time when this study was taking place, the data district level was not available across the country. So what we have done in this case is that we have taken PDHS data. PDHS data for 2017 to 2018 was available. 1 minute. Please, 1 minute I need. Okay. So we have taken 2017-18 PDHS data because that data was available across the country. At that point, National Nutrition Survey and PSLM data was not available. So what we have done is that because the sample size of the PDHS is very low, very small, not very small. What we have done is that we have clustered the data into the divisions. So we have clustered the country into different kind of the areas. So we merged the districts into 3 divisions. For example, in Punjab has the 9 divisions. So we have taken the north, which is Punjab, in case, for example, is Rawalpindi, and then the Gujranwala and Lahore, they are considered as a north. Then the Faisalabad, Sargodha, and the lower side, Sahiwal, they were taken basically the central, and then the South Punjab was taken as the other one, Multan, Dera Ghazi Khan, and the Bahawalpur. So what we have done is that for these three divisions, we sum up the data, their socioeconomic profiles together. But also for the temp, so we have used the demographic data of the PDHS. Then we also need some of the data about the temperature and precipitation, which we have taken from the district level NASA available, because at that point of the time, we did not have the district level data available for across the country. So what we have done is that we have taken the temperature and precipitation data from there, and some of those districts mean average, bringing that regional level to up to the regional level. So there was the third. So in this case, as we have then mentioned, that vulnerability index was calculated on the basis of three indexes. First is the exposure to the risk. When we talk about exposure to the risk, it does mean is that it is related to the temperature, and how much temperature variation has taken place, and it is also related to the precipitation, how much rainfall has taken place. So the data at the district level available, that was merged at the regional level by bringing at the district to the division to the regional level. Similarly, we have also took the data for exposure includes floods, districts which are prone to the floods, and the districts which are prone to the drought, and the districts which are prone to the heat waves. Based on that one, so we added that under the exposure to the risk. Then we have taken to the sensitivity to the risk, and that has been calculated on the basis of the population which is below than 5 years in Pakistan, in those areas which we have clubbed, and the population which is above than 65 years age, and then the population which has access to the water and drinking water and sanitation system. So we have taken the access to the water at the dwelling and access to the toilets at the home. Then we have taken the population which has come at the stunting, that basically, and that last one, there's the family which has adequate diet, adequate diet for their needs. So that way we have calculated the exposure to the risk on basis of then we have gone to the adaptive capacity, and for adaptive capacity we have taken the four indicators. And the first indicator was that because based on that was about that literacy rate. So the children who are attending families which have a literacy rate. Then to the health, their health has covered two aspects. One was the immunization among the children, and then was the birth attendant available at the time of the pregnancy, at the time of the child birth. And the fourth one was the access to the clean fuel, because that was linked with the pollution. So from that, we have determined the adaptive capacity. So based on that one, first we have calculated the exposure, sensitivity, and adaptive capacity. Then all these they have been summed up to determine the climate vulnerability index of the country. And we unfortunately noted that the North Sindh and North KP are the highest vulnerable regions in the country, followed by the South KP, South Punjab, Azad Jammu Kashmir, Gilgit-Baltistan, South Balochistan, South Sindh, and Central KP as vulnerable. Moderately vulnerable is the Central Punjab and North Balochistan, and less vulnerable is the Karachi, Islamabad, and North Punjab. We have given the score. It does not mean is that, for example, in some cases, there may be a reason. For example, in case of the Karachi, because the people have the high access to the healthcare facilities, have high level of education, so they have a much better adaptive capacity compared to the other regions. That is the reason Islamabad and Karachi, they are performing much better. Similarly, North Punjab reason is that these areas have a much better socioeconomic indicators compared to the South Punjab and Central Punjab. And based on that one, we have determined, and this is very close to the overall studies which has been done across the country, showing is that. But what we were surprised in this study was the North Balochistan, which we were not expecting. That has surprisingly given us that it is a moderately vulnerable. But perhaps it is when we compare between the region of the Balochistan, it seems that North Balochistan area is comparatively already is much better position compared to the other part. So in this way, what we have done is more detail is available in the study, main study report that will give you the information about that one. So what we have learned from this study is that there is a great need to engage the public in educating about the implications of the climate change. The people may know about the climate change, but there is less information. What are the implications on the climate change? For example, how these diseases are going to impact, how this water scarcity is going to impact their life in the future. Unfortunately, we have lack of any effective coordination mechanism for the climate change in the country. Punjab is providing a leadership role, very strong climate change unit and working under the PND leadership. But unfortunately, this is not very robust across the country because climate change is not a very specific, area-specific issue. It does affect across the country. So we need to strengthen this coordination mechanism up to the community level where possible. And there are complex interrelation between climate change risk. As I mentioned, is that health is very directly related to the education in one way. If the child is not healthy, it's not going to the schools. And if we do not have the water quality, we are going to impact. So these climate change risks, they have close interrelationship with each other, which makes this subject much more complex. So there is need to identify and address those complex interrelationships between different risks so that we can find a way for future. Unfortunately, we noted that early warning systems for disaster is not very effective across the country. I'm not sure about the province, but we have noted because this study was done at the national level. So this is one of the findings from the discussions with the different participants, and as well as the secondary data indicated that unfortunately, that currently people are not very much aware. For example, especially these drought features, people are not very well prepared. Similarly, in case of sometime these floods. Then we have noted that there is need for child-sensitive climate financing missing in the country in planning. Most of the climate change financing is adaptation, and still it is taking people to understand that if financing is done as a standalone project, while there is emerging need that this financing should be integrated into the planning and programming of the socioeconomic. For example, climate resilient WASH is required, climate resilient policies need to be integrated in the education system. Similarly, if it's possible, how a health system can be integrated, the climate resilient WASH, climate resilient infrastructure as a part of the health system strengthening. Unfortunately, climate change policy making does not include climate change perspective of the childs. It's mostly talking about the country level. Specifically, we are talking much more at the mitigation and adaptation at the policy level, or we are talking much more about energy sector and water as a bigger sector. Socioeconomic sector is largely missing. Unfortunately, we do not have a country-specific heat wave management plan. There is need to develop a country-specific heat wave management plan for the Pakistan. There is need to spend more money for climate research. Unfortunately, climate change research is not getting the due share, though there is a growing interest is there, but unfortunately, Pakistan is not producing sufficient evidence for climate research in the country. Again, as I mentioned earlier, but that's again, we need to integrate maternal health and nutrition planning from climate resilience perspective, which I have already talked about the health systems. And similarly, we need to increase that the climate resilience services are accessible for the children. The last two things is that there is need to be integrate climate change in the school curricula, and that there is need to increase a link between climate change, mental health, increased risk of abuse and exploitation, which is not very widely discussed and encouraged in the country. Unfortunately, as per the WHO report, mental health is going to be the next generation issue and next decade issue. And this have been shown that it is directly related with the climate change because change in temperature, change in the demographic profiles, and the change in the patterns is also affecting the children on their mental health. And there is high risk because of the forced migration, the increase of the abuse and exploitation. And all age, there is need to engage the children. And I think there is one of the recommendation is there is need to engage the children in the policy making and implementation process of climate change in the country, because these are the young people who know better that what if they've been engaged from the start, they will be in a good position to inform us the future. And thank you very much for everyone for listening. And this was a very quick kind of presentation. I did try to make it.